Good afternoon, all. So, today we are going to discuss the topic the family health nursing process. It is one of the important topic for practical in community health nursing. Okay, so when we are talking about the nursing process, I hope you people studied in nursing foundation, the nursing process, nursing care plan. Okay, so that we are following in medical surgical or hospital. In the hospital we are following, but in case of when we are talking about the family health nursing process or the community health nursing process, it is little different. It is little different. All the phases are same. The activity in the nursing process, whatever we are going to carry in the community health nursing or in the family health nursing, it is little different. For example, when in the hospital we are taking care of the patient, we are giving care to the patients directly. What we are doing, only we are focusing on the patient, only we are focusing on the patient health, physical health, mental health, emotional health, everything. Okay, like assessment, subjective assessment and subjective data, objective data we are collecting, and we are making based on this nursing diagnosis. Then we are planning and giving the all interventions and evaluating whether, as for example, if the patient is having pain, so subjective data you are collecting and your objective data will be you are observing the patient. Then pain related nursing diagnosis you will be doing, you will be forming. Then to reduce the pain you will be planning the interventions, then you will be implementing all the interventions, and after that you will be evaluating whether the pain has been reduced or not. But that is, we are talking about medical surgical or when we are going to the hospital and we are giving care to the patient. But in case of community health nursing, it is little different. We are not focusing only on the patient, only on the problem, individual problem. We are focusing holistically, full family, individual, as well as their environment, not only the patient individually. Individual patient also we are considering, family members also, as well as their environment also we are checking. So based on these we are formulating the care plan. Okay, so little different. So we are going to study today these one only, the family health nursing process or care plan, family health nursing care plan or community health nursing care plan also you can tell. So you see the definition. The first is definition. The family health nursing process means what? What is the definition of this? So see here, the family health nursing process is a systematic approach to help family to develop as well as to strengthen its capacity to meet its health needs and solve health problems. It is systematic approach is something but what? Step by step. We are following step by step. We are nursing care plan. How many phases are there? There are 5 phases. So that is step by step we are doing. First we are doing like nursing care plan we will be making means we will be collecting biodata. Then all the history we are collecting. We are collecting all the history. Then we are doing the assessment. Subjective assessment, subjective data, objective data you are collecting. Then you are forming the diagnosis, then your goal you are forming, then planning you are doing. After that planning, implementation, then rational evaluation, all those things. This is step by step we are doing. This is nothing but systematic approach. So here family health nursing process, it is a systematic approach for what? To help family to develop its capacity to family. You are helping the family. Systematic approach, through the systematic approach, step by step you are helping. Through this systematic approach, this plan will be helping, this systematic approach will be helping the family members to develop their capacity to meet their health needs as well as solve their problems, as well as to strengthen their capacity to meet the health needs of the family as well as to solve their problems related to mainly health. Okay, so here in a family health nursing process, you are following some of the systematic approach by which it will be helping the family to develop their capacity, to strengthen their capacity for what? To meet their health needs as well as to solve their health problems. Okay, this is something but definition of family health nursing process. Now coming to phases, moving towards the phases of or steps of family health nursing process. As we already knows in nursing foundation we have studied, I hope so, there are mainly 5 steps or 5 phases. First one is assessment, the next one is nursing diagnosis, third one is planning, fourth one is implementation, fifth one is evaluation. Okay, assessment, nursing diagnosis, planning, implementation and evaluation. These are all the phases, 5 phases of family health nursing process or family health nursing care plan. When you are making the care plan, when you are going for home visit or when you are going for the community health nursing posting, you will be following this only to make the nursing care plan, family nursing care plan. So these are all the first family health assessment, second nursing diagnosis, planning, implementation and evaluation. Okay, so now one by one we'll be studying the steps. In these steps, which and all you have to do, which and all steps you are going to follow. So see, first step is health assessment or family health assessment. So it is similar to, you can tell it is a similar, almost similar to nursing foundation, that care plan, medical surgical care plan. Okay, so what we are assessing? We are collecting all the history, all the data, collection of data and assessment of health needs, health problems, assessment of this one, family or baseline information you are collecting, collection of all the data, all the information as well as their baseline information about the family. In this step, assessment of the health of family and family members, it is the first steps in family health nursing process. Health assessment or family health assessment is the first step of family health nursing process. This is assessment is the first step. In this, what you are collecting, what you are doing in this step, first steps, you have to collect data, you have to collect all the baseline information, name, age, how many persons are there in the family. Okay, family structural composition, that is number of family members, age, sex, educations, then occupational status, marital status, socio-economic status. Then you will be collecting like data of family environment. Okay, in case of medical surgical, we are collecting all the biodata, name, age, sex, diagnosis, marital status, occupation, address, all those things. Here little different, like all the things as like medical surgical you will be collecting, but you have to add up so many things also, environmental things as well as family process, social functions, all those things you have to collect, holistic things. Okay, like family environment you have to, community housing condition, like whether it is housing is kacha house or pakka house, or ventilation is proper or not, water supply proper or not, their lightening, the light they are getting the sources of light in the home, it is proper or not, all those things. Then family process like communication patterns, decision making, problem solving, how they are, whether the family is patriarchal or matriarchal. The family is not giving the, like patriarchal family means they will be not giving the males, they are the dominant, they will be not giving any status to females, they will be not, only the males of the family will be making the decision. Okay, all the family process you will be collecting history. Then family function, physical, social and emotional functions of the family you will be collecting. Then family coping, life changes, family satisfaction is there or not, whether they're fighting or economic condition is not good, privacy is not there. Joint family will be there means privacy will be not there to the young generation people, all those things. Then family health status, okay, then health history you will be collecting along with other all family history. Along with this you will be collecting family health status history, that is health history, activity of the daily living. Then risk behaviors, risk behavior is nothing but like alcoholism, drug addiction, drug taking, smokings, all those things are risk behavior, unhealthy behaviors. Okay, this history also you will be taking. Then you will be collecting. Then health behaviors, how they are maintaining the health, whether they are following the healthy behaviors, healthy practices they are doing or not, or unhealthy practices. Then habits of the peoples, beliefs, customs, dietary patterns, which kind of nutritions they are taking each and every day, morning what they are eating, afternoon what they are eating, dinner what they are eating, all those history you will be taking. Then family lifestyle, this and all the history will be comes under the family health status. Okay, then family resources history you will be taking, that is support groups, friends, financial support, institutional support, NGO support, whether any NGOs are there nearby or not, they are getting support or not, support system of the family. So in this health assessment, family health assessment is the first step of family health nursing process. In this mainly you will be collecting the data of all the things, you will be focusing on the health status of the family, as well as along with that you will be collecting the history of, you will be observing, you will be collecting the history of environment also, housing pattern, water supply, social function, emotional function, lifestyle, family satisfaction. Okay, all those things, healthy behaviors. Then how you will be collecting, there are some of the methods for data collection. So you see, you will be, first one is observation, you will be observing the family as well as family, their housing pattern, their water supply, the drainage system near their home, whether it is drainage system is good or not, because unhygienic, as well as unhygienic drainage, and if the drainage system is not proper, if the environment is not sanitized, what will be happening, from there they will be getting disease condition. If the water supply is not good, there from there they will be getting disease conditions. If the housing or their home is near to the factory or near to the any chemical factory or other factories, what will be there, there will be sound pollution, air pollution, water pollution, right? So from there they will be getting disease condition. So you have to observe all the things, that family pattern, their how many family members, how they are maintaining the sanitation, how all those things from environment, housing, their home area, everything will be observing. From there also you will be getting the data, you will be collecting the data. The environment is not good, drainage system is not good, water is stagnating, from there mosquito is breeding, then family members they are not maintaining proper hygiene, they are not cooking properly hygienic food, their kitchen is dirty, all those things observation, you will be collecting the data. Then questioning, you will be asking the question, From there you can collect the information. Listening, you will be listening there, what they are expressing, what they are telling. From there also you will be getting so many information. Examinations of the body, like children's family members, the children's are there, you will be height, weight, you will be checking, anthropometric measurement you will be checking. So from there you can identify whether the baby is or children's childs are overnourished or undernourished or malnourished, all those things. Then investigation, you can do the investigation, so many investigation. From there you can identify so many problems, so many information you can get from there about the family, which family you are going to do the family health nursing process or make the family health nursing care plan. You are going to give care to that family. Okay, then review of family health record. Family health record will be there in the community health nursing, in the PSC or sub center. Family health nursing or family health record will be there. So from there you can find out, like one individual is having TB, or one person of the family is having the diabetes, or one person is having the hypertension. So many things you can, that once you are reviewing the family health record, so you can find out so many information about the particular family. So from there also you can collect so many information or so many data. Then discussion and conversation. Okay, discussion and conversation. So when you are discussing with the family members, okay, all those things, assessment, the family health nursing process, whenever you are carrying out, you should involve all the family members of this particular family, all the family members, children as well as all the elders, adults, all childrens, everyone should be there. So when you are discussing, when you are talking about the family, that when you are collecting all the history, when you are going to visit their family during home visit, so you have to discuss, you have to do the conversation, you have to do. So from there also you can collect so many data. Okay, the next is nursing diagnosis. After the assessment, we are going to formulate nursing diagnosis based on their problems, based on their needs. Because after assessment, we will be knowing all the things. We will be having one view of their problems, their needs. So based on this is the second step. Nursing diagnosis is the second steps of the family health nursing process or care plan. So after the health assessment, this health assessment will be describing family profile, in which explain all the needs as well as the health problems. Okay, you will be having one view of after assessment, that what are all the health problems they are having, what are all the needs they are having. So based on this, you will be formulate the nursing diagnosis. Either it is actual as well as the potential. Actual nursing diagnosis as well as the potential nursing diagnosis. Potential, you will be following the actual health problems also you will be seeing, as well as the actual their family problem as well as potential problems. Like for example, one person is having TB in the family, one person is having TB. So this is the actual problem of the family. Okay, actual problem of the family is one person is having TB. Second one is potential. What is the potential? From the actual problem, there may be potential, like this TB can spread to other members of the family. So other members also are at risk. Family members are at risk to develop TB. It can spread because it is communicable disease. As well as, for example, another example, drainage system is not good, like environmental. You are not focusing only on the patient condition. Remember that in the family health nursing process or in the community health nursing process, it is not like a medical surgical. or the nursing foundation care plan. It is little different. So for example, another one, like you are focusing on the environment is not hygienic, drainage system is not proper, so there will be what, so much of dirt, water will be there, water will be stagnant because drainage system is not proper, unhygienic water, from there mosquito will be coming. So the actual problem is unhygienic environment and improper drainage system. So from there, this is the actual problem. The potential problem will be what? From there mosquito will be breeding, from there mosquito will be coming there, that may cause so many problems, mosquito related, mosquito borne disease, vector borne disease. Then maybe from there so many, like there only they are washing the clothes, the drainage system is not good near to the tap area, drainage system, they are from there only they are washing the clothes, they are washing the vegetables, they are washing their hand, feet, all those things. If they are washing there only, from the drainage, unhygienic drainage, there, if small amount of water will also be spilling on the food, what will be there? That may cause food poisoning, that may cause diarrhea, that may cause cholera, this and all the potential problem. So in the nursing diagnosis, you will be seeing their actual health need problems, according to the needs, according to the interventions, you will be making the nursing diagnosis. You will be seeing the actual family problem as well as the potential family problems you will be giving. Like for example, if they are not having the economic condition proper, like low socio-economic status, that is their actual problems, low socio-economic status, that is their actual problem. So what is the consequences of this? If the family size is big, 7, 8, 10 members, but one person is earning, so what will be there? That is not sufficient. Their education system will be not proper, as well as they cannot eat, the each and every members of the family will be not having the sufficient food what is required for their body. They will be having the malnourished, undernourished, the childrens will be, because poor nutrition, they will be not eating more protein, they will be not eating more fruits which is required for their body, nutritious food they will be not getting. Okay, that is then actual another problem, like if the housing condition is not good, they are residing near to the factory, chemical factory, so there will be air pollution. Due to air pollution, they are breathing that air only, that polluted air, that is their actual problem. They are residing near to the factory. The potential problem will be they will be getting so many respiratory problem, respiratory tract infection. They may get pharyngitis, laryngitis, common cold easily, they can get asthma, they can get COPD, so many, lung cancer, so many things. So this is about the nursing diagnosis. You will be checking the actual, based on the actual problems you will be making the nursing diagnosis, as well as based on the potential problems also. You will be checking the potential problems also related to the that, then you will be making the nursing diagnosis, and you will be giving the, you will be planning to solve that problem, and you will be implementing all the things whatever you planned. Then you will be developing, you will be helping people to develop, family member to develop their capacity to meet the health needs and solve their problems. Okay, then next moving to next step, the third step, that is planning. Okay, planning, this is the third step of the family health nursing process. Here, for example, as I said, for example, if the patient is if the peoples are having, the family, they are having nearby environmental unhygienic, the drainage system is not proper, or they are not maintaining the environmental sanitation, as well as they are not eating the nutritious diet, and unhygienic cooking, they are making. The kitchen is not clean. For example, the main thing is unhygienic, environmental unhygienic, environmental not proper sanitation. So you made one nursing diagnosis based on that. So here you will be planning what and all care, what and all information, what and all the health educations, what and all the health guides, health advice you are going to give. Okay, you will be planning here, like health education related to sanitations, related to this like awareness towards the health from environmental poor sanitation, what and all the risk, what and all the health risk may come. If you are not proper hygiening the kitchen and you are not washing the vegetables properly, you are not maintaining that hygiene, what and all the risk can come, what and all the health problems can arise. Diarrhea, cholera, vomiting, food poisoning, so many things can happen. Okay, so based on this, you are going to give the care, you are planning the care, what and all you are going to do in the implementation phase, what and all action you are going to do to solve that problem. Okay, so here there are some steps including in planning of the family health nursing process. First one is you have to analyze the health problem. What is the health problem of the family member? Okay, you have to analyze the health problems as well as the health related problems. You can tell. Then establish the priority. What is the more important things related to the problem? For example, one person is having TB in the family. That is the actual problem, the health related problem. You will be analyzing that one. You will be examining that problem. Then you will be establishing the priority. So what is the priority? You have to isolate that patient. That patient should not spread this TB to other members of the family. Along with this, you have to give the DOTS therapy. Okay, DOTS therapy for that patient. Then you will be setting the goal. Goal is nothing but to solve the problem. Isolate the problem is nothing but what? Isolating the patient. It is preventing the spreading of infection. That is your goal, to prevent the spread of infection as well as the cure the individual patient. That is, for that you are giving the DOTS therapy and isolating. Then identify external and internal sources of the problem. What is the internal source? What is the external source of this problem? Then formulate the family health and nursing care plan. After that, planning, you are formulating the nursing care plan. Okay, so planning is the third step of the what? Family health nursing process, and this is concerned with the formulation of family health nursing. This planning will be helping you to formulate the nursing care plan, and in these planning steps there are some of the steps you have to follow. First one is analyzing the health problem. The next one is you have to see the priority. What is the patient requirement? Priority. For example, TB. So you have to isolate. Then you have to give the DOTS therapy. You have to give the nutrition to the family. You have to give the psychological support to the family and patient, and maintaining of the family members' health, full family members' health. All those. This is the based on the things you have to prioritize one by one, which is the main needs. Then second one, then third one. Step by step you are going to focus on and you are going to follow. Then setting goal, and then identify what is the external sources of that problem and internal sources of that problem. Then formulate the family health and nursing care plan. Okay. Then moving to fourth step, that is implementation or action phase. Whatever you have planned. Example I have given as TB as well as the environmental sanitation not proper. Or else you can take like poor nutritious diet they are taking due to low socioeconomic status. So what and all the problems they may arise. So you have goal, you have planned, like if the unhygienic sanitation is there, environment, you are going to give the health education, you are going to motivate the peoples, you are helping the peoples to bring the awareness towards the health, and you are going to tell what and all the consequences may come from that problem, that poor sanitation, and what is the type of family and how they are maintaining their proper family, what is the family things. Okay, as well as you have to influence the family, influence, you have to tell all those things, what and all you have to explain. The main thing is you have to give the health education based on that. And for example, you this whatever you are planning, that health education, awareness, all those things, in implementation stage you are going to do, you are going to give the health education, actual health education to them, you are going to give the health related educations to their peoples, that family, that people. Okay, so thereby they will be understanding. When you are explaining all those things, when you are giving health educations to that peoples, whatever action you are giving, whatever you are following, whatever health, family health nursing care you are giving to that family, you have to involve each and every one of the family members for their active participation. Okay, active participation. Poor participation will be there means their implementation, their your care plan, whatever you are giving, you are doing, that will be not effective. For better effectiveness or effectiveness of your nursing care plan, nursing process, you have to make them to participate properly. Proper participation, full involvement of the family member should be there. Okay, for example, another one, like one person is ill in the family, one person is ill in the family, so thereby you have to involve, like you are going to give care to the family members, you are going to give the health educations to the family members, so you have to involve each and every children's as well as other all the members. So children's also should learn everything, because if one person is ill in the family member, other person is going for working, so the children also should needs to learn what and all the care that individual should get in the family member, in the family. Like for example, your father, your mother is ill, but other members, each and everyone are going for the work. So what and all care this father required, absence of other members of the family. If the children are there at home, these children can give. Like then he needs water, he needs helps to get up, he needs cares to, he needs help to when he is going to the washroom, when he is coming to the coming from back from the washroom, he needs care, maybe food, maybe something else, whatever, walking, all those things. So if the child like 10 years, 12 years or is there, they also needs to understand everything. So once everyone's are not there, what is the benefit, you see what is the benefits to bring all the children also in the participations of health education. So when you are giving, this is the benefits. Children are there at home, if other members are going for work or whatever, they are busy, whatever, they also can support the individual who is ill. As well as some behaviors, like if the children are not behaving properly, that is also one stress for their family members. So children should learn which is good behavior and which is bad behavior. Nowadays adolescents peoples are going for the what, they are following western, this one, they are following that is the standards. If they are following the alcoholism, they're drinking alcohol, if they are smoking, if they are taking the drugs, but it is unhealthy behavior, right? That is also will be stressful for the family. This family health will be, family mental status will be changed, mother and father will be not eating properly. These all those things are this. So when we are giving care as well as you are giving the health educations, whenever whatever care, whatever your action you are implementing, you have to involve all the family members and you have to give care to the family members properly based on their needs. If they are poor planning, you are not planning properly, poor your planning as well as lack of resources to give care to the family members, and poor IPR, you have not built, you didn't build one good relationship between you and family members, that also will be causing the error in achieving the goal. You will be not achieving the goal. What is your goal? Improve the family members capacity to meet their health needs and to solve their problems. This all those things. So this is the implementation. Whatever planning, whatever you are doing based on their needs to solve the problem, whatever you are planning, that planning will be acting. This is the action phase. This is the fourth phase. In this phase, the nurses, the healthcare professionals and the family members together, they are working to solve the problem. Whatever the problem is, maybe environmental, maybe health related, maybe family, maybe nutritious, maybe other things. Maybe related to contraception, maybe family planning problem, maybe health related problems. There are so many family problems will be there. So overall family problems you are seeing, and based on that you are making one nursing diagnosis. Based on that nursing diagnosis, to solve that problem you are planning. This planning, whatever you have planned, that you are going to implement here. The next is evaluation. This is the last step. After giving the action, during the action phase also you can check whether you can check your participation, your performance, your care, whether it is effective or not. Okay, summative as well as formative, you can do the evaluation. Evaluation is nothing but what you are evaluating, how much your goal has been achieved, how much your objective has been achieved. What is your goal? To solve the problem, health related problem, maybe whatever it is, whichever problem may be. Okay, how much you have. So if it is successful, your planning, your implementation has been solved the problem. Okay, solve the problem, that will be helping for you for the next visit. Next visit, if you are facing same problem, you can follow the same steps, same way you can solve the problem. Okay, so evaluation is the last steps of the family health nursing care process or nursing process. It is helping for you to measure how much your goal has been achieved. You can do the formative as well as the summative evaluation. Like evaluation during implementation phase, that is called formative, and evaluation after the nursing process, how much you have achieved, how much you solved the problem, that is summative. And this will be helping for you to you can do here the comprehensive total how it was the home visit. Okay, during each visit you can do the comprehensive evaluation when you are giving the nursing care to the family health or else family health services to the family. Okay, and thereby it will be helping for you to focus on, like if you are doing the next visit or other visit, if the plan, this home visit and this care plan has become successful for you, you have solved the problem or near to solve the problem, that will be helping for you to carry out your next visit or something. Okay, so hereby today we have studied family health nursing process definition, then phases. There are 5 phases: family health nursing process, family health nursing assessment, then next thing diagnosis, planning, implementation and evaluation.